Good afternoon. And so, in looking at this issue of a framework for assessing health impact of biofuels, of course, we have learned so much in the last day and a half, and in a way, I think that some of this my talk definitely benefits from that. And there are a number of health drivers that have made us consider biofuels, or that are issues that are embedded in a health assessment of biofuels. And certainly that, we wish to reduce air pollution. We know that air pollution is making too many people unhealthy and killing people. We wish to reduce greenhouse gas emissions, which is also a form of air pollution. We wish to have increased fuel security. We wish to see benefits to rural economies. We wish to see more energy produced for growing populations all over the world. And certainly we want to increase the availability of energy for future generations, or the sustainability of energy production, something that I as a pediatrician have been particularly concerned about, and that is the well-being of our children and our grandchildren. So reducing air pollution, what might we consider? I mean, certainly we might consider how fuels burn and whether one fuel is cleaner than another fuel. And we do wish to produce fuel oxygenates, and we know that ethanol has wound up substituting for MTBE and some of the other oxygenates. We want cleaner diesel. We know that burning diesel is very polluting. We wish to reduce ozone and PM levels and levels of VOCs, and to generate electricity for households that currently burn biomass fuels that are very, very dangerous in terms of the pollution they produce indoors. But at the same time, we need to consider, as we heard, the life cycle effects, and that the air pollution levels need to be considered not only in terms of burning the fuels, but also the life cycle of the growth of the plants, the production of the fuels, the transport, as well as the combustion of the fuels. And we know that that is not generally how we perform risk assessment. As this, looking at the second objective, we certainly wish to reduce greenhouse gases. We know that global climate change already is having a profound impact on the public's health and is continuing to do so. We've had 2 meetings about that for this roundtable, and I'm sure that this is a topic we'll be talking about more in the future. And we know, from Dr. Searchinger's talk and certainly other presentations that we had over the last 2 days, that in the past maybe we've had assessments that were overly optimistic in terms of the potential of biofuels to reduce greenhouse gases, largely because we weren't accounting for the fact that plants might have been growing where the biofuel plants are being grown in the first place. And so that that should have been taken into account, and probably wasn't, but for other reasons as well. So again, I think there's been a message of the need for a careful life cycle analysis, and certainly the message that I've received the last couple of days, that there may be no dramatic net benefit or increase in terms of greenhouse gases, and that biofuels may not play a major role here. Fuel security doesn't sound like a public health issue, but I think it very much is a public health issue. I think that increasing fuel security could potentially increase national security, could potentially prevent adverse health impacts that are related to regional and global conflicts. And these impacts occur directly, but they also occur indirectly because of displacement of populations and impact on civilian populations of any kind of conflict. In the U.S., as we saw, the energy use per capita is so massive that the potential for biofuel production is relatively small. And there didn't seem to be any convincing data. We saw over the last couple of days that biofuels are going to, or at least at this point in time, improve fuel security for the U.S. Of course, there's always the hope that newer technologies would more efficiently produce biofuels. Benefit for rural economies would be another thing that I think would provide health benefits that we could think about. Wouldn't usually fit into a risk assessment framework, but we do know that rebuilding rural communities could be beneficial in terms of rural infrastructure, for health care, for transportation, for education, that as rural populations are depleted, that they have loss of services and all of those in other areas as well. That certainly has a major impact on health in those communities. But then on the other hand, we've also heard that biofuels may not actually result in dramatic increases in jobs and may not serve as a strong incentive for holding young people in these communities. That's what you always hear out in rural America, for example, that the loss of young people, the outmigration of young people is responsible for many of those negative impacts. The other thing that certainly needs to be considered, and we almost never consider in a risk assessment context, is the potential for boom and bust impacts on health. And that is, if you have an industry that's built up through a combination of tax incentives and subsidies and mandates, and then if those are loosened, that you can have a boom created by those government mandates and then an economic bust that's created when those mandates disappear. And that's certainly another concern, as well as the long-term concern, and again, thinking about future generations of overexploitation. And that is, if you are having depletion of soil and depletion of water resources, that in the long run, that could even be more damaging to rural economies and the health of people who live in those parts of the country. The next goal, increasing energy availability for growing populations. Another area that we don't usually factor into a risk assessment, but we do certainly know that when people live at a very low level of energy availability, that there are major health benefits associated with increased availability of energy. This doesn't keep going on and on and on linearly if you have more and more and more energy. There's very little evidence that the level of energy consumption that we have in the US, for example, is actually beneficial to our health. We probably have some health impacts from overconsumption. But certainly, you know that displacement of dirty and unhealthy fuels is beneficial, that having light available in households helps to promote reading and literacy, having sources of energy that don't require a lot of manual labor by children and women gathering firewood and fuel, that's beneficial in terms of education and economic activity. And that energy can be useful for things like assuring food safety, refrigeration, health care, being able to deliver immunizations to people. And so there are many parts of the world that obviously need more energy, need more clean energy, and biofuels perhaps have the potential to provide local sources of such energy in those countries. On the other hand, legal mandates in places like the US and the EU may be making biofuels less affordable in developing countries by raising the prices and because of creating demand in the US and Europe for lots of biofuels. And if biofuels are raising food prices among these same populations, that could offset benefits to health. In terms of increasing the availability of energy for future generations, the question does need to be addressed of whether biofuels are actually renewables. Very often in discussions that I have with people, there's an assumption that they are. And I think that we've heard through many of the talks in the last couple of days about the fact that that is not, in the long run, actually the case, that there is the requirement for chemical fertilizers and pesticides. There is depletion of soil. In many parts of the world, there's an increased use of water, especially fossil water supplies like the Ogallala Aquifer, and competition for water that is needed for other human uses for the environment and for future generations. And we also know that there's a limitation of an ability to expand biofuels production given the concomitant need to expand food production. And I think we heard that in our first talk for this meeting, and that is the reality with growing populations as well as increased development worldwide, that we need to be producing more food as well as more energy. But then again, there's the hope that new technologies might be more sustainable. So in conclusion, we know that governments like the US government, Brazil, the European Union, and others have rapidly moved forward with mandates, with subsidies, and at the same time, and they've promoted the development of biofuels. And at the same time, there's been very little consideration of potential health impacts either today or in the future. And I think it's fair to say that this has been more of a politically driven process than a science-driven process. There are new methods of assessment, like sustainability assessment and health impact assessment that we're going to hear about from the other speakers. I think that these are very promising. But I want to pose an issue that I think is more fundamental than that, and that is how policy processes can be re-engineered to actually support the conduct of any kind of health assessment before such decisions are taken. And currently, this is not the case. I think that that is an enormous challenge that lies before us, not only as a country, but I think for the world. And I don't have the answer to that, but I think it is fundamental to the problem that we're looking at today. Thank you.